Have you ever wondered what you shouldn't or what you should allow into your vagina? Yes, a lot of women have thought about this. Is this okay? Is this not okay? So I'm here to bring you the juice. Welcome everyone to today's teaching. And I'm your host, Gwendolyn Halley. Let's roll in. I'll be teaching you 8 things you should allow to go into your vagina and you will still be healthy. These 8 things are things that you haven't thought of, or maybe you have thought of, but you are still wondering if it's okay, or maybe you just need confirmation. Now, the first on the list is a clean penis, a clean dick, a clean male genitalia into you. If you allow an unclean penis into you, you are going to have vaginal infections. It's especially for men who are unhygienic and for men who are uncircumcised, and men who have balanitis, phimosis, and even penile cancer. You are going to be having this. Now, I've received several, comments under my videos of ladies telling me, can you help me out? I am having reoccurring vaginal infections or vaginal itches, and I've done this and I've done that. I've been on treatment on antibiotics. I've been on treatment taking antifungal and even antiparasitic drugs, and it's still recurrent. It's still reoccurring. What can I do? And I always tell them, make sure your partner's genital is clean. Now, what happens is most ladies go for treatment or go for medical checkup and they don't take their partners along. And so it's just a waste of time. So what you should do is when you are going for a checkup, monthly or yearly checkup twice a year, take your partner with you. And if your partner is unhygienic, teach him how to wash himself or share this video with him so he can be enlightened. Like I always tell ladies, when you have foul smell or when you have vaginal itches, you are going to be labeled as an unclean woman, as a woman who sleeps around, who is promiscuous, or as a woman who can take care of herself. So you have to love yourself and love your body more than your spouse. Because if you are not healthy down there, you can't be healthy up here as a woman. So please look into this. The second is a clean tampon or sanitary towel. Now, what some women do is they actually insert into their vaginas sanitary towels or tampons that are not clean, and they have infections. Now, the next point is to use a non-expired pessary or vaginal, what they call ovules or a vaginal drug into you. What I notice some ladies do is they actually take oral drugs, that is, drugs meant for oral routine, and they insert it into their vagina. Most probably they haven't read the leaflet, or most probably they are ignorant, or most probably they are trying something, I don't know. And sometimes I see that some ladies take pessaries and they actually swallow them. And this is for ladies who maybe are trying out a 24-hour pill. They can swallow one Postinor 2 tablet and they insect the other one because they want rapid or effective result. But it doesn't work that way. So make sure you are using, the right vaginal drug or pessary. It's not expired and it has been prescribed, and your vagina is going to stay healthy. The next is using of sterilized or clean vaginal screening or vaginal swabs. And I'm talking about the device used for transvaginal exams and also the speculum, which is used in collecting swabs. Most people don't sterilize them. Now, there are plastic speculums available, and sometimes the transvaginal device is not being cleaned properly, or maybe they don't use a condom, because what I see most health professionals do is they wear a condom on top of the transvaginal device when they want to insert it into the woman, because it has to go right through her cervix into her womb, into her uterus. So make sure that the hospital that you are choosing to go through has these, hygienic standards. Next point is using clean fingers. Now, this is linked to point number 1. There are some people who like to have one night stand and they don't care what fingers they are sending into them. It may be a finger that has a fungal infection. It may be a finger that has dirt underneath the nails. It could be an unwashed hands. It may contain parasites and what have you. And you allow this finger to go in during sexual activity or during stimulation or arousal, and you are going to be having vaginal infections or recurrent vaginal infections. So make sure that the penis you're allowing in and the finger you're allowing in to penetrate you during arousal, during foreplay, or during intimacy is clean. And this is why I will advise. I did a video on what you should do before sex and the things you should do after sex, and you need to watch it. It's going to help you to stay healthy, to minimize infections, to minimize urinary tract infections, minimize vaginal itches as well, and a lot of complications that arise after intimacy. The next point is using certified lubricant. Make sure you go to the pharmacy, you ask for a certified lubricant, whether it's oil-based, water-based, or silicone-based. I did videos on lubricants, using spit as a lubricant, using vegetable oils like coconut oil, olive oil, hemp seed oil, maybe even liquid paraffinium, Vaseline as a lubricant, the effects, the disadvantage, the consequences of using it. So please watch it. The next point is use a non-expired condom. Whether it's a female condom, whether it's a male condom. This is going to help you. It's going to prevent you from having any form of sexually transmitted disease or even getting pregnant. The last point is using prescribed sterile birth control devices. And I'm talking about IUDs. Intrauterine devices. These are devices that are placed in the woman through the vagina to prevent the sperm from fertilizing the egg. So, I hope you have been blessed. I hope you have been inspired. You have been sensitized through the points I have given you. Now, nota bene, when I talk about vagina, it is the unseen part of your female genitalia. And when I talk about washing or cleaning your vagina, I am referring to the visible part of your genitalia, which is called the vulva. So whenever you read or whenever you watch a video and you hear cleaning or washing the vagina, it doesn't mean washing inside the unseen area. The unseen area should be left unseen because it's self-cleaning, while you should focus on cleaning the outer part, the visible part of your genitals. Thank you for joining me in today's class. I remain your seasoned medical microbiologist, Gwendolyn Halley.